coming back to you, Jody, you talked earlier about how you had surgery within a week, really, of the diagnosis, and fortunately did not require a colostomy bag. Did you have open surgery? You mentioned, I think, that you had laparoscopic surgery.
Right, I had laparoscopic
surgery. So you didn't have a bag, you didn't have a big scar, but it's still a major operation. Tell us about your experience with surgery. How long were you in the hospital, and what was your recovery like afterwards?
I was in the hospital 4 days, and it went quite well. It took a while for my bowels to get going again. And when they start to get going, they're pretty sloppy. And so there's certain embarrassments with that. And so you have to learn to live with that and call the nurses, and the nurses are all very supportive. What happened was, as I was ready to go home at the 4-day point, the nurse came in and said, you need to be on blood thinners for another 2 weeks, so you're going to give yourself shots. And I went into a complete panic. So I was okay with the surgery, but I was not going to give myself shots under any condition whatsoever. And so it was back and forth with the nurse. No, I'm not going to do it. Yes, you're going to do it. No, I'm not going to do it. And so she finally said, okay, well, then you can pay to have a nurse come in and do it.
And was that just the sheer fear of needles? Or?
Oh, absolute fear of needles. You chase me around the room to try to give me a shot. I don't like needles at all. And she said, well, we can order a nurse to come in, but you're going to pay for it.
And just to clarify for people who are watching the segment, you've been through the surgery. The blood thinners are to prevent you developing clots in the legs or the lungs after surgery, like DVTs, pulmonary emboli. Is that how they explained it to you?
That's how they explained it to me, so I understood why. I just didn't like the news, and I didn't like my role with it. I thought, why can't I get a pill? So when she told me that I'd have to pay for the nurse, I mean, she was lovely about it all, but she said, this is what goes on. I said, okay. And so, I grabbed a piece of my tummy, and it was such a moment of change for me. All these years of my life, to actually stick that needle in, it was like, oh my heavens, oh, I didn't faint, I didn't die.
Did you think about asking your daughter to help with this?
No, because I knew she's as bad as I am.
She's inherited the needle phobia gene.
Oh yes, well, it runs through
maybe there's genetic testing for that.
We decided that there is genetic, because my natural mother also scared to death of needles. So I found that by day 3, it was like, oh, okay, there it goes. What a change for me as part of the recovery. Now, I went to a friend's house.
You felt empowered by getting over this crazy obstacle.
No, I still have the bottle with the needles. I saved all the syringe.
So I take it you don't have a tattoo.
No. And I took photos. I thought, wait a minute, this is my change of life right here, is needles. But the surprise, and I think it's back to the point that you made, when your scar is this big, you think, oh, not a problem. It was a slow, very difficult recovery in the sense that I had no energy. And my mind and my body both were really not up to par. I was teaching a course, and so I couldn't really manage the course, and I was very shocked that I couldn't be staying in touch with my students.
You bring up a very good point, and in fact, Dr. Bayasi, there are studies in my profession in urology that show that if you look at patients who've had open surgery to remove the prostate versus robotic surgery, one would assume that the patients who had the smaller scar, the minimally invasive surgery, who were in and out of the hospital, would do better psychologically. And yet that's not what's been shown in studies, that many of these patients are actually quite depressed after surgery. And the belief is that for many of these patients, it's all about expectation, that they believe that if they don't have a big scar, that they're going to bounce back quicker. And often, if we are discussing treatments with patients, there is a tendency to think, oh, it's minimally invasive, it's day case almost, you're in and out. And yet, Jody brings up a great point that she didn't feel as she would expect to feel based on the size of the incisions, which imply that what's gone on is actually fairly minimal, which is not the case. Do you find that that's a big issue, that patient expectation sets the scene?
The post-operative, course is not just affected by the size of the scar or the wound that we do in the patients. And on the inside, the procedure is the same. we're not doing any different procedures than the same. So we're still freeing up the colon from all the attachments. We're still tying up big vessels that supply the colon and putting the two ends together. So that by itself, just when you cut yourself, the pain is going to be there. So healing on the inside is going to have a toll on your body. But again, the minimally invasive will help out in the pain, I would say, for a big portion of that, and for the post-op recovery as far as leaving the hospital and being back at home. Some of the things that keep the patient longer is the pain usually if we have to do the big operation. But again, the expectation should be set right for the patient that even though that we're doing this through smaller incisions, that doesn't mean that it's not a big operation that you're having on the inside. And you may have some post-operative course that you will have to go through to recover.